Alright, so we're going to do combo. That's going to be a combo between Pre-Mod and the ultrasound head. The ultrasound head you set up is going to be your cathode. It's going to be the one that is evoking the contraction when it's rubbed over the motor point. So we will click on combo.
And for Pre-Mod, are you using it to mimic conventional TENS?
No.
Or conventionals for not for causing
Yeah, we
contraction?
want to cause a contraction. So what we do here, right now you're setting up, it's set on ultrasound. So what we're going to do is set up the frequency for ultrasound. 1 megahertz will be for a deeper tissue, and then you can change it to 3.3 by pressing enter when this is squared around it. 3.3 would be more of a superficial tissue. Right now I'm going to just test it on my quadriceps, so I'm going to say that is a deeper tissue, so I'm going to click it on 1. I want it at a continuous so that when my sound head rubs over the motor point at all times, it will, depending on when I hit that motor point, it will contract. We can then set the mode. With combo you can use high volt, IFC, or Pre-Mod. Our professor prefers Pre-Mod, so we're going to stay with Pre-Mod. Don't press Pre-Mod though. So that's set. So now we have our ultrasound set. If you click enter, you're going to change to set your Pre-Mod. Notice that Pre-Mod is selected for channel 2. Just make sure that on your lead you have channel 2. Again, we're supposing that this is the anode because our cathode is going to be with our sound head on the gel. Put this on the muscle at some point.
Does it matter if it's distal or proximal?
I honestly don't think it matters if it's distal or proximal. And so we want this also to be continuous so that at all times if I hit the motor point it will contract it. Beat frequency depends on what type of muscle we're hitting. So postural again is something around 30, and fine motor is something around 50. So I'm going to pick fix because I want to fix it to what I want to fix it to. So I'm doing a postural muscle. I'm going to go down to about 30.
And it's 30 to 50 is what is the significance of that?
That's going to hit your critical fusion frequency of your muscles. That's when they will cause the contraction. So we have everything set. I'm going to go back up here to make sure we're back on ultrasound. Before you start turning up the intensity for the ultrasound, you want to make sure that the ultrasound head is in contact with the gel on the skin and already start moving the ultrasound head. You're going to turn up the intensity, which is in watts per centimeter squared, and I'm going to turn it up to 0.5.
Okay, and the intensity for ultrasound can range from 0.25 to 2.0. With increasing intensity, you get an increased temperature. So in this case with ultrasound, like an intensity of 0.5 to 1.0 watts per centimeter squared is a low intensity and higher frequency. That would be for areas with less tissue coverage, like a bone that's close to the skin. And then 1.5 to 2.0 watts per centimeter squared is a high intensity. So that would be for elevating tissue temperature over a large area of soft tissue, like a hip or back.
So at all times, make sure you're moving the sound head. Right now you've already set up the ultrasound, so you can click start. Again, you can change the time for whatever time length that you want it. So over here you see that next we need to set up for the Pre-Mod. It's on line 2, so we're going to go up to line 2, and now we can change the intensity of the Pre-Mod. What we're looking for with that is to watch the skin. You want a muscle contraction. I'm starting to feel it as the patient. I'm continuing to increase the intensity. As soon as you get a muscle contraction, starting to get one, whenever this head rolls over that motor point, you will see that contraction occur. So there's a motor point there. you will just treat this area for the time that it hurts.
How long would you say treatment for this would last?
I think you want to do a 10 to 15 minute treatment. And then you can stop.